Hello friends, today we discuss about pre-diabetes diet. So pre-diabetes does not have to develop into type 2 diabetes. Certain habits including eating more fiber, monitoring carb intake and limiting portion sizes can balance your blood sugar levels. Pre-diabetes is characterized by higher than normal fasting blood sugar or higher than normal blood sugar after eating. It's most often the result of insulin resistance, a state in which the body does not use the hormone insulin properly. People with prediabetes are at an increased risk of developing type 2 diabetes and may also be at risk of developing cardiovascular disease. A diagnosis of prediabetes does not mean you will definitely develop type 2 diabetes. The key is early intervention to get your blood sugar levels out of the prediabetes range. You cannot control every risk factor for prediabetes, but you can address some of them. Lifestyle changes can help you maintain balanced blood sugar levels and stay within a moderate weight range. Now, how diet relates to pre-diabetes? Many factors can increase your risk of developing pre-diabetes. Genetics can play a role, especially if diabetes runs in your family. However, other factors play a larger role in the development of prediabetes. Not getting enough physical activity and having overweight are other potential risk factors. In prediabetes, sugar from food begin to build up in your bloodstream because insulin cannot easily move the sugar into your cells. The amount and type of carbohydrates you consume at a meal influence your blood sugar. A diet filled with refined and processed carbohydrates that digest quickly can cause higher spikes in blood sugar. If you have prediabetes, your body likely has a difficult time lowering your blood sugar levels. After meals, watching your carb intake can help you avoid blood sugar spikes. Now eat more fiber rich foods. Fiber offers several benefits. It helps you feel full longer. It also adds bulk to your diet, making bowel movements easier to pass. Eating fiber rich foods can make you less likely to overeat and help you avoid the crash that can come from eating a high sugar food. High sugar foods will often give you a big boost of energy but make you feel tired shortly afterward. Examples of high fiber foods include beans and legumes, fruits and vegetables that have an edible skin, whole grains such as quinoa and barley, whole grain breads, whole grain cereals, whole wheat pasta. Now, monitor your carb intake. The glycemic index GI is a tool you can use to determine how a particular food could affect your blood sugar. In general, foods that have a high GI will increase or raise your blood sugar faster. Foods with a lower GI have less of an effect on your blood sugar. However, different people's bodies may process these foods differently. Additionally, cooking a food or eating it along with protein or fat can change its GI. glycemic index. It's also important to be mindful of portion sizes. Eating a large amount of any carbohydrate containing food can cause your blood sugar levels to rise. Low GI foods. Foods that have a low GI, such as high fiber foods, are best for your blood sugar. Incorporate the following items into your diet: non starchy vegetables such as carrots and leafy greens, beans, sweet potatoes, nuts, and seeds. Food and nutrition label don't mention the GI of a given food. Instead, take note the fiber content listed on the label of in order to determine of a food's GI ranking. Medium GI foods. Foods that rank in the medium range on the GI glycemic index are fine to eat if you have pre-diabetes, although it's important to keep portions to about 1.5 cup. Examples include whole wheat bread, brown rice, corn, sweet cut oats, as opposed to instant oatmeal, stone grounded whole wheat bread, pasta, preferably whole wheat. Keep in mind that brown rice, wheat pasta, and wheat bread typically only have 1 or 2 grams more fiber than white rice, white pasta, and white bread. For this reason, it's still important to limit your portions of these foods. Now, high GI foods, foods that are refined, processed foods, and lacking in fiber and other nutrients, register high on the GI scale. Refined carbohydrates are one example. These are products, mostly grains or sugars, that digest quickly in your stomach. Some examples are white bread, russet potatoes, although eating the skin may lower the GI, sugar sweetened soda, juice. If you have prediabetes, it's important to limit these foods and drinks. Eating mixed meals is a great way to lower a food's GI. For example, if you plan to eat white rice, adding vegetables and chicken cooked in a small amount of heavy or healthy fat can slow down the digestion of the grain and minimize blood sugar spikes. Now, number three, be mindful of portion sizes. Paying attention to portion sizes can help you keep your diet on the GI scale. Often, portion sizes in the United States are much larger than intended serving sizes. Food labels can help you determine how much you are actually eating. The label will list calories, fat, carbohydrates, and other nutrients or nutrition information for a particular serving. If you eat more than the serving listed, it's important to understand how that will affect the nutritional value. A food may have 20 grams of carbohydrates and 150 calories per serving. If you have two serving, you will consume 40 grams of carbohydrates and 30 300 calories. So, a study in more than 15,000 adults showed that a lower carbs diet, less than 40% carbs, is associated with the same mortality risk increase as a high carb diet, more than 70% carbs in adults. A study noted minimal risk of observed when people consumed a moderate amount of carbohydrates, that is 50% to 55% carbs in a day and on a 1600 calorie diet, this would equal to 200 to 220 grams of carbohydrates daily. Now, carbohydrate needs vary based on your stature and activity level. It's good idea to consult a registered dietitian to discuss your specific needs. Now, number 4, eat lean meat and other proteins. Meat doesn't contain carbohydrates, but it can be a significant source of fat in your diet. Eating a lot of unhealthy fats can lead to prediabetes as well as high cholesterol and heart disease. If you have prediabetes, eating a diet low in saturated fat and trans fat can help reduce your risk of developing heart disease. Choose protein sources such as beans, legumes, soya beans products such as tofu and low fat Greek yogurt, eggs, chicken, turkey, fish such as cod, flounder, etc., tuna fish. Now, lean beef cut such as steak. So, these are the foods. Drink alcohol in moderation. Moderation is a healthy rule to live by in most instances. Drinking alcohol is no exception. Many alcoholic beverages are dehydrating. In addition, some cocktails may contain high amount of sugar which can cause blood sugar spikes in your body. Now the following are the measurement of an average single drink. One bottle of beer equal to 12 fluid ounce. One glass of wine equal to 5 liter oz, and one shot of distilled spirits such as gin, vodka or whiskey, that is 1.5. Now keep your drink as simple as possible and avoid adding sugary juices or liquids. Also keep a glass of water nearby that you can sip on to prevent dehydrations. The most important point, number 6, drink plenty of water. Water is an important part of any healthy diet. It's essential to drink enough water each day to keep yourself from becoming dehydrated, my dear friend. If you have prediabetes, water is healthier option than sugary sodas, juices or energy drinks. These beverages typically contain calories that translate to quick digesting carbohydrates and have little or no other nutritional value. Now remember that exercise and diet go together. Exercise is a part of any healthy lifestyle. It's especially important if you have prediabetes. A lack of physical activity has been linked to increased insulin resistance. According to the National Institute of Diabetes and Digestive and Kidney Diseases, exercise causes muscles to use glucose or sugar for energy and makes the cells work more effectively with insulin. The physical activity guidelines of Americans recommended that adults get at least 150 to 300 minutes of moderate intensity aerobic activity per week. 75 to 150 minutes of vigorous intensity aerobic activity per week. So exercise does not have to be overly complicated. Consider walking, dancing, riding, a bicycling, or any other physical activity you enjoy. For those with limited mobility, chair exercise is a great option. So be healthy and be happy in your life. And as I always says that always consult with a doctor who will be the advisor for your health. Thanks for watching my videos. Good day.